And in 2012, we'll have an extraordinary opportunity, because we'll be able to say, next year you're going to spend $15,000, $14,000 or more on healthcare. And you're going to have to buy private insurance. Or you can spend less and get more benefits. That's a fight I welcome. That's a fight all of us should welcome. Because the one advantage for our movement of this reform is that now we have something, not just a system out of control and corporate special interests in the insurance industry dominating our political process to prevent real reform. Now we have reform that we can say doesn't do the job. And that people are committed to solving the healthcare crisis, have an alternative. And have an alternative in many of our states before this really goes into effect. That's the extraordinary opportunity that we have before us. We've been given that, not by people's, not because that's what everyone wanted. They want us to go away, right? They want us to say, and you'll hear this, the next thing you'll hear is, give the reform a chance, right? Let's see what happens. This is something we can build upon, right? We've laid the foundation, now let's let it grow, right? Can't you just hear it now, right? And we're going to say, hell no to that. Because we have a better solution. We have the real solution. And when we wage that fight in California, in our states, we will have new allies. We'll have the allies who accepted the political wisdom of viability. The only argument there ever was for the public option was political viability. How viable does it look right now? Right? How viable? The whole premise of that was, we can't win the debate over government-run healthcare. Well, yeah, you're right, because you lost it. And we can't win single payer, so we got to do this public option. And frankly, it simply didn't prove to be any more viable. And we have to confront that ourselves. We have to win that debate that publicly financed and publicly administered healthcare is better than market healthcare, is better than the private market. We have to win that debate. And that's something we got to grapple with. We cannot pretend that everyone, that the political class or small businesses or even the uninsured folks, or certainly not the insured, are going to believe that the government can do it better. Right? We're going to have to confront that head on. That should be something that really we talk about this weekend and going forward, is how to win that debate. We usually can win it, as Don Beckler would say, in one-on-one conversation. Right? We can usually win that debate in one-on-one conversation. But we're going to have to win that debate on a mass scale. And we're going to have to figure out tactics and strategies to win that debate. I think we can. I think we've been given a great opportunity. And I think what we need to do now is to understand we're going to have, as we talked about last night, we're going to have a lot of different approaches to this. But the one thing we can't do, and some of us will decide to oppose this bill, to demand a no vote, and that is a righteous demand. There are labor allies who we've worked with who will not do that, even though they agree with us. And the most important thing is that we cannot say to those folks, you're the problem. The problem are those who promote this plan, right? The problem is not here, right? The problem are those forces that we have to do battle with. And we need to be united on that, even if we may take different positions on this bill at this time. But we're united in the goal of a real solution to our healthcare crisis based upon the needs of patients, not the ability to pay for care. And that's our fight, and that's the fight we're going to win. Thank you.
All right.